Hi, Mike Sevilla here for FamilyMedicineRocks.com, and this is a video that was recorded at the annual spring conference of the Society of Teachers of Family Medicine meeting here in New Orleans. It was recorded on Thursday, April 28, 2011. The topic is social media in family medicine. The co-presenters are Mark Ryan and also Ben Miller, and this is a pretty entertaining video. Why? Because Mark started off talking about some of the platforms out there in social media like blogs and Twitter, and midstream during the presentation, Ben walks in. Why? Because he was running late because of the airlines, and he said he was watching the session live on his phone because we were streaming live on the internet on the STFM Ustream page. I want to thank STFM for making their page available to us. And you'll see in the video that this is a very amateur video, but I brought my own equipment. But I just wanted to show the family medicine community what we can do basically with zero budget. So you'll see the very amateur video going on here, but at least it's a first step for this meeting, and I think for the family medicine community. Other things that we did is there was another session that was streamed live. That was a session I was involved in, and other things that we did. I wrote some blog posts during the meeting, posted them up on my site. We did a lot of Twitter and Facebook during the meeting. I did a live internet radio show from here in New Orleans where I interviewed Mark Ryan, one of the co-presenters for this video. And we also did a live Twitter chat called FamMed Chat. And we did that in the lobby of the hotel. We found some people who were on Twitter here during the meeting. We saw them in person. And we were able to have a chat with people here at the meeting and also people off-site on Twitter. So a great participation that night. So hopefully we were able to show the family medicine community the power of social media. So I hope you enjoy this video. Please forward your comments to FamilyMedicineRocks.com. Enjoy the video.
Our talk is titled in the book as Patient-Centered Engagement, a Social Media Approach. We renamed it a little bit to try to come at it from a different angle, which is to discuss social media and try to discuss some of the tools that are out there, some of the uses, but also why we think that this is valuable tools to communicate with patients and communities and peers. So trying to make the argument that there is value to using social media beyond what folks might already be familiar with, and why we think that it should be something that can be added to a busy day in a way that would be productive, in a way that can add value to your time engaged in it. The format, of course, is one of just a diary or an essay or a posting based on whatever the writer is most interested in. The social part of it is that you can choose to allow comments, and you can have dialogue back and forth in the comments. You can include also different media. You can put pictures, videos, links, things that are relevant in the text of the blog, but it's a little bit more static. It's a post, it's comments, but there's not as much back and forth dialogue on it. The numbers that we found is there are 500 million active users, and about half of those people on Facebook are logging in on any given day. So there's a lot of traffic and a lot of movement on Facebook, a lot of folks passing through. Facebook, used in different techniques or in different styles, offers different benefits. There is an ongoing discussion amongst those of us interested in social media as to how you use Facebook as a professional. If I'm there as a physician, for example, how do I use Facebook? The consensus so far seems to be probably to separate your personal presence and your professional presence. I'm on Facebook very much for myself. I'm on there as me, not as a public advocate or a public outreach person. So I've locked it down pretty tightly. It's mainly limited to people that I know. But if you do that and you're on Facebook also as part of your professional personality, a practice, a residency program, or whatever, having a parallel one that allows more interaction in that nature seems to be the most commonly used approach right now. Moving on to Twitter, it's a little bit of a different paradigm. How many folks in here use Twitter? More than I've actually seen in other talks I've given. Twitter is a very different setup from the other techniques that we've used before, in that Twitter is characterized by the nature of the message. Twitter messages, or what we call tweets, are very, very short messages. You have 140 characters. And that's not 140 words or phrases or anything. That's your spaces, punctuation, anything you want to put on there. It's 140 total. The reason for that is because Twitter was designed to work on text messaging type technology. And internationally, you're limited to the number of characters text messages can carry. So when they developed it with that in mind. So the way that Twitter works, and it's going to be a little bit of jargon for the next few minutes, and again, holler if you need me to clarify something. When you post something on Twitter, you tweet something out there, you put your message out there, anyone who follows your account can see you. You can have a private account where your tweets are protected. That is not the default for most people. If you're on Twitter, you want some interaction and you want people to see what you're doing. For the most part, for most of us, if you tweet something, it is visible to whoever wants to see it. Anyone who follows you then can read what you have to say and make it, determine for themselves how interesting it is. Everyone on Twitter has a name, and the name starts with the @ sign. So for example, I'm at Richmond Doc because I'm a physician in Richmond. Ben Miller, my co-presenter, is at Miller7. And he and I, this is a good time to say, social media, there is that tendency to think that it's a little bit superficial, that it's easy to skim the surface and not really get very deep. This talk actually exists because of social media. Ben and I, when we submitted the abstract to STFM, we had never met in person. We didn't meet in person until we gave a similar talk a month ago. We formed the initial relationship through Twitter, through online discussions, through a lot of back and forth dialogue and debates about resource sharing and things, and we realized then we started emailing each other and put the connection together. So if I want to email Ben, I can email, or if I want to tweet Ben, I can tweet him at Miller7, and he'll get a message saying that I contacted him, but everyone else can see that. So it's like we're having a conversation in a room and a couple other folks are listening in. You can engage in the discussion, you can choose not to. It's up to each person how they want to engage. So if we tweet something to each other, but Mike Sevilla, who's manning the camera over here, recording the chat today, actually live streaming the chat today, if Mike sees something that he's interested in, he can retweet it. So you'll see a lot of RTs if you look at Twitter. That's someone who saw something interesting from one resource, who is passing it forward to somebody else. That means that it's linking network to network. If I put something out there that Ben thinks is interesting, Ben can then tweet it to his network. And if someone in his follower group finds it interesting, they can pass it on to their network. I have about 1,500 people who follow my account, not all of whom are active, probably not all of whom are real. But even if a certain number of those people pass it on, a certain number of their followers might see it, and it allows information to spread pretty broadly without a whole lot of investment up at the front.
And can I just point out thanks to Kevin, who's at Tag Student 31. He's outside and says the stream is coming in great.
So, I guess I should say, no one's on camera right now but us. But if you do ask questions, we are actually live streaming this with the STFM's agreement to test out how some of this technology can help with conferences and educational stuff down the road.
And I watched the entire presentation from CAP, literally on my phone. I'm thinking, oh man, that was the part I was supposed to make the joke.
Yeah.
Oh, man.
He's the funny one and the one who dresses well. I am the other guy.
This is the first presentation I can say that I have ever done without a tie.
So there's the retweet. There's the reply where if I send a message to @Miller7, it'll come into his Twitter account as a notification. All of that's public. All of that can be seen. Now, if I want to send Ben a message like, Ben, your airplane is late and you're giving me a heart attack, it goes as a direct message only to him, and it does not show up on the public stream. The general rule that I understand, as I understand it, is if you don't want it to be public, if you don't want information public, don't put it on any of these social media tools. Even a private direct message, there's at least some possibility someone smarter than me could crack into it and pull it out. So I don't do anything that I would not want folks to find. But it's a way to discuss with somebody in a little bit more of a private way, or just to not clutter up the discussion with things that other people might not be all that interested in. A little bit more jargon, and I do apologize for this too, but this is pretty important. There's something in Twitter called a hashtag, which is just a number sign. Hashtags allow you to tag a topic that you're discussing in such a way that everyone else who wants to find out about that topic can find it easily. So for example, if you want to do something about healthcare reform, it's generally accepted that hashtag HCR is healthcare reform related tweets. So if you go online to Twitter and you search hashtag HCR, you'll bring up anything that's been tagged that way. Again, with the STFM's agreement and kind help with the wireless stuff, we are hashtagging STFM for everything that we're doing here at the conference. So there's actually a group of probably four of us that are kind of core people, and I think there's another 6 or 8 who've kind of picked up on the discussion too. And we're all tweeting back and forth, hashtagging STFM about topics, about talks we're in, about highlights of presentations, things like that to keep the discussion going. What that allows then is to filter through a lot of information in a fairly targeted way. And it also allows for what we call Twitter chats or tweet chats, where you can have an active online conversation by using the hashtag as the organizing principle. For example, last week we started hashtag FamMedChat, which is a Twitter conversation designed for family physicians, people interested in patient-centered medical home and patient-centered care, team-based care, etc., to meet virtually online and discuss topics of interest. And all we do is we set a time. It's actually going to be, there's one tonight at 8 p.m. Central. If you go online and you search Twitter for hashtag FamMedChat, you can see dialogue going live. You can actually see a conversation where Kevin Bernstein, who's MD Student 31, is going to be moderating it. He'll be putting out the topics, but everyone who's interested can dialogue back and forth, talk about each other's points, provide information to each other. So it really does allow for a lot of valid online discussion to happen at one time without needing any specialized equipment or any specialized technology.
Oh, I feel like doing a lot of things right now. Not to tell you this story, but I feel like I do need to give you some explanation. I had 2 delays and a taxi driver who couldn't work the credit card machine. And so he eventually said, well, you're supposed to, I was showing him the video. I said, that guy right there, I'm supposed to be with him. And he said, well, just go on and mail me a check. So I literally have his home address to mail him a check. Oh, New Orleans. Okay. Thank you. Thank you. It's so great to be here.
Mailing the check on Twitter.
No, I don't think so, no. But it was funny to watch. There were several of you in this room, who I will not mention, who were saying, yay, he's finally here. He did come. He did come. So let's, how much time do we have? I'm sorry.
We have 15 minutes.
15 minutes. Okay, great. Well, let's go through this. Obviously, Mark has done a great job describing the tools to you. And having the tools in and of themselves is really just a conduit for how to release or disseminate that information. What we're going to talk about now is a little bit different. It's a shift. We're going to talk about the way that you can use these tools as an engagement tool. So one of the keys that Mark said, and I heard him say this because I was watching him, that at the very beginning, was that social media in and of itself is not just a one-way communication. If it's simply about sending out information and not having information come back in and you respond to that information, what difference is it in any other tool that we use? Not really much different. So what social media can do and why this matters for healthcare is because it allows us to have almost integrated within the redesign of healthcare at large, or even just within our own personal healthcare delivery, opportunities to engage at a very different level. Think about the level of continuity that your clinic can have when it has an online presence. Think about the level of continuity that you as a provider can have when you are out there not necessarily giving clinical advice to these patients that are talking about their heart rate at 2 in the morning, but just saying, here's some information. I do this all the time. This is a great article that I read online, and I send it out. I'm a total mental health and primary care guy. That's all I tweet about, and give these guys a hard time. It's simply what I am most interested in. So people that want to know about that can come to my Twitter account, can come to my Facebook page, can come to my blogs, and they can learn about that from me. I see this as a way to provide a level of continuity that may be a little bit different than that relationship that I have in the exam room with the patient. So think about how social media can change the way that we deliver healthcare. And this is where it gets really fun. When you have an emerging technology that has been ill-defined, you know that it has a capability, it has a way to get the message out there. How can you then begin to use that within your education, within the education modules, within your residency, within your practices, within your own learning? How can you begin to use that? Public health advisories, this is a big one. We talk about this frequently because there's some great examples from the CDC, from certain departments of public health, where if there is an emergency, how to get the message out there when, let's say, the phone lines are down, but people still have cell access. There's ways to do this. And you'll see examples of, we have the latest and greatest vaccination that's in. Tweet that out so that everybody in that community that's following that Twitter account or watching that Facebook page can come to the clinic because they know that it's now there. Answer general medical questions about research as a clinic for general topics. I mean, this is general, this is not specific to you. Occasionally, someone will pose a question either on a blog post or on Twitter, and they'll say, hey, do you know any research about, or do you know where I can find resources about? And I say, yeah, of course. And you link them. And there's an ability to connect the community that's really quite profound. And then, of course, advocacy. We're going to run out of time, so I'm going to skip a little bit faster here. You can see the examples, more examples here. Disease-specific reminders. I had a really interesting call yesterday with a gentleman who may be watching this broadcast who's using mobile technology as a way for folks with diabetes to track their A1C. And it's taking a picture of little QR codes, which we all know what those are, little funny things in magazines now you can take pictures of and buy stuff. And you're able to actually look at your glucose, your A1C over time based on these pictures that you take. It's a really novel way to do this. But what happens when you integrate that within a tool like a social media tool, like a Twitter, like a Facebook, that does send out reminders, that does say, hey, everybody who's on this diabetes chat, how can we work together? How can we form a community here to help each other out? You see this everywhere online. Social media is no exception. You envision how social media can change healthcare delivery and continued. There's ways to ask patients to contact the office. We met with our practice manager and we talked about ways that they can have an internal communication through social media, where when the clinic's not going to open for 2 hours, they can all have some way to spread that information or communicate to the public, communicate to the community, hey, snow day, clinic's going to be closed 2 hours later. Send that out. If you brand your clinic, if you brand yourself, people will follow up. Helping patients find tools. You can see, have a personal Twitter account and a professional Twitter account. Many, many people do this. They have the one account that they're very pristine and they say only the things they would want their mom to know about, that's professional. Then you have this kind of the other side of them that's all political, talking about how they love one political party. It happens all the time. Personal and professional benefits. Mark already mentioned the ability to collaborate and to meet new people. Mike and Mark are a great example of that. We have, I think this year alone, through my Twitter account, I've had 6 or 7 different either interviews that have been published somewhere in a magazine or online, or different types of professional opportunities to collaborate.
So to wrap it up, we think that social media communication tools are going to continue to impact how doctors and patients communicate. I think as a system, we're early in figuring this out, but I think it's important that healthcare providers are in this discussion because patients are actually quite a ways ahead of us on using these tools, and it's really important for us as healthcare providers, physicians, teachers to be working towards this. I think there are lots of opportunities to use this for education as well as for advocacy and other things, and it's a matter of starting to stake that space and start to define it as